Thanks everybody for joining us today. This is Libby Sagara. I'm with Blue Path Health, and my colleague Lauren Jacobson is on also. We support the Central Valley eConsult Coalition, which is a project of Anthem, also supported by Calviva and HealthNet. So we welcome new participants, and I apologize for my phone in the background there. And it's going to keep ringing. So one moment, please. So sorry about that. Back to the days of the landline when we still have phones ringing in the background. So those who introduced yourselves, thank you so much. We'll have people coming in from the waiting room. And today we are going to spend just a moment for those who are new to our group, introducing our objectives of our coalition. We like to highlight a clinic or provider every month who really does give a lot to our coalition. So we'll be doing our clinic spotlight. And we're really pleased today to have ConfirmMed focusing on a couple of cases for GI and COVID. So important to you all. And we've heard loud and clear that these are specialties or areas where we really do need support through eConsult. We're very excited to be able to push forward with our CAP program that we'll talk a little bit about, the Child and Adolescent Psych program. In addition, talk a little bit about other resources, continuing medical education, and other programs that we have up and running for you all as part of our coalition. Thanks to you who are new to our group and you've used the chat to introduce yourselves. Also, thanks everybody for taking a moment to mute yourself if you're not participating in the Q&A. Thanks so much, since we have a good number of people on today. Just taking a moment here, so glad to see our group grow, and we have new participants from Tulare County here. I know we have Sante on. Thanks so much for joining, Sante. And in addition, I think we have Kauai Delta on too. So glad to have some additional participants. We do have a website that is econsultworkgroup.com/Fresno. We started out just in Fresno, and we've expanded to many other counties at this point. So glad to have you all on. If your name is not on this list, we'll update our website and add your name to our list of participants. We've met on a monthly basis for about the past year or so, and we just look forward to expanding to additional FQHCs, rural health clinics, Indian health centers, and other providers who see Medi-Cal managed care patients. So thanks to you all who join us on a monthly basis. If you are new to eConsult, when we talk about eConsult, we're talking about asynchronous communications between primary care providers and specialists. We've seen some great data over the past probably decade or so. I know the ConfirmMed folks who are on a call today probably been doing it for more than 10 years, but eConsult has some great outcomes in terms of improving response time to get specialist advice, getting patients scheduled more quickly, reducing patients' wait times, reducing the need for unnecessary face-to-face visits, preventing patients from having to travel when they don't have to, reducing no-shows. And what we're seeing is pretty high satisfaction from primary care providers and specialists, but we do understand that providers are really spread thin right now. So we're trying to provide resources that make sense to encourage them to use eConsult. And we try to just convey a sort of a standard statement about eConsult and hope that we can share this among our providers, that we hope that as part of this program, all primary care providers would consider eConsult as a first step to a specialty referral for those requests that are non-urgent and routine and non-procedural. So all referral requests can go as eConsult. Our eConsult providers see, gosh, I think it's near 70 specialties. I may be wrong there, but the majority of specialty requests that you need that are routine non-urgent can be responded to through eConsult. A lot of times we hear from providers and clinics, what happens when that eConsult needs to be scheduled as an in-person visit? Sort of amazingly, as part of this coalition program, we've seen around 75% of our eConsult requests being resolved without a face-to-face visit. That's a pretty amazing data point. However, those that do need to be scheduled in person, we try to encourage the clinic to reach out to that patient to make sure that that is scheduled with a specialist when those cases need to be seen in person. And just a bit about our coalition. As I mentioned, we've been around for over a year now. And so our goal is really to get providers on the phone and stakeholders in eConsult to talk on a monthly basis and provide resources, continuing medical education, case examples like those we'll talk about today. We worked last year to really push for e-consult primary care provider reimbursement. We'll continue to do that in 2022. We appreciate your leadership as clinics, in addition, the leadership of our managed care plans that we have on Anthem, Calviva, and HealthNet, really showing leadership and support and vocal support for e-consult across the Central Valley. And what we've been able to see now is a great dashboard showing the data around utilization and impact on care. We like to review that every so often to show everyone that the progress that we've made, which is great to see. And this model, starting in Central Valley, has now grown to Sacramento and North State too. So others are following your lead with the great work that you've done in Central Valley. But we're reminded daily, I'm sure you are all reminded with being in the clinic setting or with the news that you get sent to your phone as you wake up every morning, that our providers are spread thin. So that is one of the reasons we try to provide education and tools and resources as part of these monthly calls, why we put them at noon if you can get away from caring for patients. We know that providers are not only essential workers, but they're seeing essential workers. And right now, people are spread thin dealing with COVID vaccinations and testing. We appreciate those providers who are doing that on a daily basis. And that's going to be one of the themes of our discussion today, is e-consult in response to COVID cases. This article was from last week, and we really appreciate the support of California Primary Care Association, real proponent of e-consult too. And with that, I want to thank a few providers who've been consistent participants and supporters of our e-consult work group. Omni Family Health, Lisa Atkinson, thank you so much for being so responsive. Whenever I ask Lisa a question, she responds immediately. She's always really on top of things that any question that I ask, and it's wonderful to have the support of Omni and as active participants and senders of e-consults. Thank you so much, Lisa. And I'm not sure if we have Aria on today. Severina, if you're on, I want to thank you. Over time, over the past month or so, we sent out a survey asking for clinics to respond a little bit about their needs, tell us about what they want to see happen with our e-consult coalition in 2022. Severina, thank you so much for responding to our survey. And I did a drawing to be able to reward one of the respondents of our survey, and Severina, you won. So you'll get a $25 gift card. Thank you so much. My survey was 5 minutes, so thank you so much for your time. And Lisa, I don't want to put you on the spot, but do you want to say any words about just e-consult and your experience to date? You might be on mute, Lisa. And you also might be caring for patients or in the trenches, so I'm not going to bother you. But Lisa, if you come, oh, there you are. Do you want to say anything about your experience?
There I am. Yes, I just want to thank you for your kind words, and I can't say enough about the program. We're decreasing unnecessary face-to-face visits, and this program really helps the provider, really develops our primary care providers. When they're nervous about making a decision, we get a quick response from specialists through e-consult, and I just think it's just a really nice program to develop the providers and also help the patients who are waiting for weeks to get into, and even months to get in to see a provider, so a specialist. So thank you for your kind words. It's a pleasure to work with you. I'm enjoying this.
Thanks, Lisa. Appreciate it. And thank you all who really pipe up on our calls. We want to make these interactive and conversational. Anyone is welcome to join the conversation, ask questions, use the chat, take yourselves off mute anytime during our call. So Aria, Severina, if you happen to be on, you're welcome to pipe in here. But we had some great responses to the survey that I sent out over the past couple of months, just asking what your needs are for 2022. And these were some trends. We asked you all what your top five specialty access needs were. I have 7 here because these were the trends. I just wanted to make sure I heard all of those that were repeated as top needs. And I think you're all familiar with these in terms of their scarcity and challenge in getting patients to be able to get these visits scheduled. So we're seeing a lot of requests for behavioral health and psych. That could be due to the pandemic, the pressures that families are facing, not only child psych, but adult. And endo-room neurology, we're hearing so much of a need for. We're so happy that today we're going to hear a little bit about GI, and we'll talk, what the ConfirmEd team is going to talk in a minute about GI, and cardiology and infectious disease were also mentioned as high need. These quotes, I'm sure some of you might have said them yourselves, but I think these are these are right on point for what we try to do as part of our group. We need more specialist providers available. Some specialties are scheduling months out, and that's why we want to do e-consults for these specialties, because you don't want to have to make your patients wait that long. You said you wanted to see letters or pamphlets to share with the patients regarding referrals or e-consults. Well, if you got my email today, that handout is attached. So there's a patient flyer. It says patient flyer that you can print, distribute to your patients if you wish, to help your providers to talk about e-consults, since I know it's a concept that's unfamiliar to many patients or members. And one of the questions we asked you all was, who do you want to see become more involved in these monthly calls and our coalition calls and our coalition activities? Of course, primary care providers. And we know many of you schedule right through lunch, so it's hard to tear yourselves away to be able to attend these calls. If you are on and you're a PCP, thank you. And this quote, I think, summarized perfectly what we want to do here. E-consults allow primary care providers to collaborate with specialists before sending the patient for a face-to-face visit, resulting in more patients being managed at the primary care level. So keeping that decision-making with the primary care provider, keeping the medical home with the clinic, so important, and glad to see that nice succinct comment about e-consult. Any thoughts or questions around the survey? This is the patient flyer that I have attached to your email. If you are on my distribution list, you've got this, and if not, we'll make sure to send it as a follow-up to this call. So you can print and send this out to any, give this to any patients or put them in your provider's waiting rooms so that they can give these to patients to explain how the consults work. Really, the points that we want to be able to hit home are that e-consult may prevent a patient from having to travel to another appointment, that once a patient's need is sent as an e-consult, that the loop needs to be closed and that the clinic will reach back to them to tell them what happened as a result of this e-consult. So we hope that this can help patient communications. We also welcome feedback if there are any other types of tools that would be helpful in patients, explaining to patients how e-consult works. And with that, I'm going to hand over to ConfirmEd. Dr. Darren Anderson and I believe Marianne McGuire are going to speak to a couple of cases of how e-consult has been used to address COVID-19 and GI needs. And I think you're starting with GI, Dr. Anderson?
Yep, I have, if you can let me share my screen, I'll pop
Yes.
up a couple of cases and we'll jump right in. Marianne, do you want to kick us off?
Absolutely. Hi, everyone. It's nice to see and hear you all. We really look forward to these calls to just connect on some topics that we're finding are really important in your geographic area, and GI is definitely one of them. Probably for the last few years, getting GI access for your patients has been a struggle in the Central Valley, and Libby just spoke to that in terms of the feedback you're giving her. And, you know, to show that over the last year, we've had 1,000 GI e-consult requests from California, the majority coming out of Central Valley. And, you know, with that is that we can solve some of the GI questions that are coming in from the providers in your practices in a way that allow them to take care of the care going forward. And importantly, relieve the strain on the system outside. And by that, what I mean is it frees up spots on the schedule. It allows those patients that need to go face-to-face, either initially or after an e-consult, quicker access into your local GIs. And we hear that from people like at Omni, like Lisa, who just spoke. And Family Healthcare Network has shared that with us. Norma has talked about that from the referral team. So we know the importance of GI access on e-consults in the Central Valley. And, you know, looking at our data when we were getting ready to talk about this, we see that about almost 70% of the e-consults that come in on GI can recommend, our specialists say, primary care providers, you can do this within primary care, and here's how. Let me give you the guidance. And Darren's going to give you some examples, but the trends we were seeing are the trends that, if you're a CMO or you're a nurse manager in these practices, you know this. You know that there's lab abnormalities in the liver functions that have so many questions that a GI specialist can answer that so easily by looking at those labs and guide you, the provider, in the interpretation. The same thing with working up, alcohol liver disease, and is it IBS? And if it is, how do I manage it? And what do I do if what you've suggested didn't work the first time? And, the list goes on, but this is what we're seeing, these type of cognitive questions that can really help your primary care providers grow in their knowledge of managing GI cases.
Great, thanks, Marianne. And I think I'm going to do something a little different because I know most of you have heard me speak before, heard Marianne speak before. We could all speak about why e-consults are the greatest thing and how to do it and all of that. And that's important. But I think personally, it's really important to ground myself in the actual consults. And I think that an e-consult is worth 1,000 words, if you'll humor me with that. And so I'm actually going to geek out a little bit, and I think there's value in looking at some of these. These are real consults. We've de-identified them, so we're not violating any HIPAA or anything like that today. But these are real consults that we pulled out of our consult inbox over the last several months, demonstrating how primary care providers in California are using GI consults. Because I have to say, when I first started doing e-consults and setting up our specialty network, I didn't think there'd be a lot of use for GI because I figured it was all scopes and procedures and things. Well, and certainly there are. But what I'm going to show you is a couple of examples of where e-consults for GI provide value. And I think it helps to ground us in, why are we doing this? And what do these things actually look like? And I think you'll see three things from the consults that I'm going to share. One, you'll see what Marianne spoke to, how an e-consult can prevent an unnecessary visit and strengthen the capabilities and the scope of what can be done in primary care. And that's the metric that we all love to show. 70% prevented a face-to-face visit. Our payers love that for obvious reasons. It's a great metric. And we know that behind that is a patient who didn't have to take a day off from work, who didn't have to drive a long distance and wait months to get in. There's a second value, though, that I think we don't talk about as much, and I call that optimizing the face-to-face visit. And this is when ultimately the specialist and PCP agree that the patient should be seen face-to-face, but the specialist guides the PCP in how to approach the workup. I always like to say, in the meantime. We know that even if we all agree they need a face-to-face, that may take months. Well, what do I do in the meantime? How do I manage? And how can I start the workup so when they get to the PCP, they get to the specialist, they don't have to go back 3 times. The specialist has what they need to do during that visit. And the third, which is a little more subtle, but I think ultimately maybe the most important part of this initiative, is what I call preventing future visits. By providing education and guidance to the primary care provider about this case, the PCP can learn from it and apply it to the next case that looks similar. And so I'm going to just highlight, I'm not going to read all of these line by line, but I have a couple of examples. And as I've left this one up, hopefully some of you have had a chance to read it. But basically, this, as you can see, the PCP writes a nice question. And you can see, the PCP has been thinking this through, suspects that this is IBS. The patient has constipation, abdominal pain, tenesmus, not relieved with diet changes. The Rome-3 criteria, for those of you who aren't clinical, are a set of criteria for irritable bowel syndrome, which the PCP is thinking about. But as he or she points out, the patient currently only meets 1 out of the 3 criteria clearly. And so the patient, maybe they saw on TV a new medication for IBS called Linzess. And the primary care provider says, exactly here, I'm looking for recommendations on the workup, on how to clarify diagnosis and management. And here, if you kind of look through what the specialist does, recommends a series of labs, how to work that up, also suggests H. pylori, talks about the appropriateness of an abdominal pelvic ultrasound, goes on, needs a flex sig, recommends a couple of procedures. So this person likely will ultimately need a face-to-face visit. But look at the rest of it. If these are negative, I'd recommend, here's how to manage. So I call these contingent recommendations. The GI doctor has a pretty good idea of what they think they're going to find. And here's some recommendations, assuming they're right, for how the PCP will ultimately manage that. If this is IBS, here's how you counsel the patient. So labs, imaging, treatment, counseling the patient, all included in education. So we would classify this as recommended a face-to-face visit because the provider did say you got to send this person for a flex sig, and therefore patient needs a face-to-face visit. And we might, classify that as a fail. Well, gee, the e-consult didn't prevent an unnecessary face-to-face visit, but look at all the detail in this consult that prevents 3 or 4 visits. That prevents a follow-up visit, and that may in the future avoid an unnecessary visit the next time this primary care provider has an IBS case. Here's another one, a little bit tighter and easier to kind of look through, but this is a very common, Marianne already showed our most common diagnoses. This is a person with a history of alcohol, some question about how much they're currently drinking or whether they used to drink. But the primary care provider has already started the workup, has liver enzymes that are elevated and an ultrasound that showed increased echogenicity, which raises concern of fatty liver versus cirrhosis, as you can see. So again, I also use this to show what's an example of a good question. How can the PCP help guide the specialist in terms of what they're looking for? What is the next step in workup? This is what my plan would be, et cetera. Would you agree with this plan? Any additional information, et cetera. And so in this consult, you can see the specialist, a little bit more terse, but equally pithy, if you will. I don't have these results, although we did reach out and get those results and update them. But this is typical for fatty liver, not cirrhosis. Goes on to make some specific recommendations for how to dig into that a little bit, that distinction a little bit more, to help the PCP to determine what they're dealing with. Now goes on to talk about how to work this, how to continue to evaluate and manage over time. Again, a series of labs are recommended to expand the differential diagnosis and rule out some uncommon conditions like celiac or Wilson's. If all of the above is negative, we can be confident abnormal LFTs are due to fatty liver, non-alcoholic steatohepatitis or alcoholic hepatitis, and the PCP in this case attached an LFT workup algorithm and some other helpful documents. We would have classified this as prevented what otherwise would have been a face-to-face visit. And you can see again the value in preventing a visit, but also in educating the provider in how to approach workups like this when you're wrestling with the differential, the variety of things, but particularly non-alcoholic steatohepatitis versus alcoholic hepatitis and cirrhosis. And the last one I'll show, I won't go through it in as much detail, but again, this is an incidental elevated LFT workup. Well, it does admit to 10 to 12 beers on weekends, and the PCP has summarized the labs, has an ultrasound, and goes on to talk a little bit about what he or she was thinking and ask some specific questions. Is it appropriate to GI surgery? Should it be referred to gastroenterologist? Because there was an interesting finding on the ultrasound that he's referring to. So I'll simply sort of summarize and show that the specialist has reviewed all the attached information and gone on to discuss the typical pattern of elevated liver enzymes in somebody with alcoholic liver disease. And there's a page 2 talking about education. We can geek out a little bit, but you can see has gone through to talk about extensively the workup of LFTs, how to deal with the issue of a potential gallbladder polyp, and then fortunately for everybody, since this is the equivalent of a short chapter in a textbook, plan, further testing and evaluation, bing, bing, bing. And as you can see from number 3, the initial step is to follow up with a GI physician. So again, this would have been classified not in that 69%, but in the group of ones that did not prevent a face-to-face. But look at all the value that was provided in that consult, in all the education and all the workup that the PCP was guided through, which shows that that metric of prevented face-to-face visits is a very imperfect metric that really under captures, I think, the value of many of these consults. And I'm going to quickly put up a COVID-19 example to show sort of what's happening now with COVID, as we are getting lots of questions related to COVID as well. Just to emphasize, the adaptability of the e-consult process. We didn't even have COVID or a specialty several years ago, and now it's one of our more common referrals. This is an example also from California of a 49-year-old woman who had COVID-19, who, as the PCP says, used to hike and run up and down stairs and attend to ADLs regularly, and now can't. There was more detail in the chart notes that were attached, but this was the summary. And you can see again what the specialist has done is summarize the case, what they see in their review, and the approach I have taken in cases like this is as follows. pulse ox follow-up. Spirometry needs to be followed up. At times we need to do a chest x-ray or even a CAT scan periodically. There's the labs that we do, therapeutic intervention. Quite commonly patients need bronchodilators, sometimes nebulizers, inhalers. It talks about oxygen already. And then the specific criteria for how to decide post-COVID if somebody's appropriate for oxygen. And so, again, this was actually classified as one that prevented a face-to-face visit because in this case, the PCP got a tutorial in how to manage long-term pulmonary symptoms from post-COVID. But again, I think, my main point, which I think I've maybe kind of driven home, is that simply measuring how many prevented face-to-face visits we're getting from an e-consult really underestimates and misses at least some of the value. This isn't just about preventing unnecessary face-to-face visits. It's about strengthening what can be done in primary care, both for the current case and for future cases.
Thanks, Darren. That's a great point. And I love the fact that being non-clinical, that the last thing I read on that COVID case was that this can be managed by the PCP, right? So that there are detailed instructions as to how that patient can be kept at the clinic, does not need to go to the ER, and that there's a very detailed protocol as to how that patient can be managed effectively. So I want to open up for questions. Any questions for Dr. Anderson or Marianne about other cases where you might wonder about the efficacy of COVID treatment through e-consult?
I will say I didn't show an example, but we're also getting questions about vaccination, particularly some of the potential medical contraindications to vaccination. We've seen providers presenting, unusual immunologic conditions and things, and asking our immunologists or allergists or ID providers whether this particular condition is a contraindication to vaccine. So we're getting more questions about post-COVID, but definitely some around vaccine-related questions as well. And I did want to say, I forgot what I was going to say before, those specialties that were listed top on your survey, those are some of our most commonly utilized across Central Valley and California, including psychiatry. We have psychiatry. It's underutilized in California. For some reason, our Washington providers use it a lot. But a good psychiatry consult with advice on med management is extremely helpful for PCP that's trying to manage things or doesn't have access to behavioral health. And so those are definitely available now through this program as well.
Thanks, Darren. Do you have any, I think we had an opportunity to talk about this too, that do you see cases where e-consult might be used effectively for long COVID or situations where patients need to be managed over time?
Yeah, the one that I was just showing was kind of a bridge. It wasn't exactly long COVID, but it was post-COVID. But yeah, in fact, I just looked at one yesterday, patient that had long-term loss of smell. We consulted ENT and they were asking for advice about how to manage that. So we're definitely getting cases about that and other long COVID type symptomatology. Absolutely. Yeah, and we've been talking about creating a separate specialty called COVID-19. The challenge with that is COVID-19 isn't a specialty.
Right.
ID, a lot of them go to ID, but we as often send them to pulmonary or cardiology or ENT or neurology. So we've been debating internally whether or not we should sort of create that as a separate specialty that the PCP can request. But I think we probably won't for that very reason. Usually the PCP knows which specialist or which specialty they want related to COVID, since it involves so many different systems potentially.
Thanks so much, Darren. Are there any questions for Dr. Anderson? Or any comments from the group? Well, thank you again. I do welcome you all to use the chat if you'd like to share any questions as you think of them. And we can always connect you with those who want to, or if you would like to have further discussion on this. One of the specialties that we're discussing that is very relevant to COVID, that we are seeing such a spike in terms of need. As Darren mentioned, COVID-19 is not a specialty, but the impact on our patients and on our providers of COVID has really made itself clear when we see the increase in needs for psychiatry and behavioral health. So unfortunately, Dr. Steinbuchel, who was on earlier on our call got pulled away. She sees patients. And just want to highlight, we've talked about this program on our past few calls, that this is something that's available to our eConsult providers. The CAP, Child and Adolescent Psychiatry Portal Program, not only offering teleconsultation by phone, but a hybrid phone and eConsult communications modality. So it's great to see that a phone consult program has grown to be able to incorporate eConsult too. This is available to all of our Central Valley providers. It's free to them. And as you can tell here, not only does it involve the teleconsultation piece, but a one-time actual communication and ongoing communications with UCSF. So there are a couple of CME opportunities. We're going to speak up briefly, but Karina, do you want to say anything else about the CAP program while I have you on here?
Yeah, I would just like to add that the UCSF psychiatrist, Dr. Steinbuchel, she is a part of the ConforMed specialty panel as well. So if you would like to enroll in the CAP program, you can also, we can also, default Dr. Steinbuchel to be the responder to the specialty eConsults for children and adolescents in the Central Valley. So this isn't just offered to Fresno, but this is Madera, Kings, Tulare as well. So any practices that want to enroll in this program, you can do so through the link, and it takes only a few minutes to enroll. I'll add it in. Oh, thank you, Libby. You added it to the chat. Yeah, so again, this is for if you have primary care providers that want to do a quick consult with the UCSF psychiatrist through telephone or eConsult. This is a really great program to tap into. And it is grant funded. So this is going to be ending at the end of this year. So we're hoping to get enrollment and utilization out of this wonderful program. So thank you so much.
Thanks, Karina. And ConfirmEd team, if you'd like to say anything about the program, please do pipe in.
Yes, hi, it's Marianne McGuire. I think at any time, any of the practices who are in Central Valley, you're aware of this. Michelle Chapman and her team have been talking to you about, the pediatric psychiatry CAP component, and we're here to help if you, if that just got missed in all of the emails that you're getting all the time. Happy to talk with you. It's really, you just need to do it. It's available there. You just say pediatric psychiatric eConsult, and it will go to this program. Our team will handle it from our end. So we're looking forward to seeing some more of these on the pediatric side as we move into 2022.
Thanks so much, Marianne and Karina. And if you do have any questions, please share with us. As Karina mentioned, the registration process is super simple. We'd love to see more of these requests come in since we have so many providers enrolled, but I know providers are spread thin, so we want them to remember that this resource is there for them. And just to once again focus on our need and the needs that we've heard from providers around the real demand for psych. This is what we thought of as a perfect opportunity to provide some continuing medical education for our teams. This session is open not just to providers, but anyone who's interested in eConsult for behavioral mental health, continuing medical education for clinicians. I just put the SurveyMonkey link, which is just the registration for the CME, into the chat. If you would like to share this with your teams, this is free to them. We heard loud and clear, thank you, Central Valley Indian Health, if you are on. Someone noted to us, we can't do this at noon. This is when we're seeing patients, we're booked straight through noon. We moved this to 5:30 p.m. so that providers can attend. I know it's hard to work into the evening, but it's unfortunate when providers can't attend because they're scheduled straight through their lunch. So we're putting this in the evening hours so providers can have the opportunity to attend if they wish. So Dr. Steinbuchel, who you may have heard on our past calls, is presenting, and we'll go through examples of eConsult for behavioral mental health, not just child, but adult too. Okay, and Karina, thank you for the note on the CAP program coverage in the chat, if you'd like to take a look. Just a reminder to everyone, we have I was talking to a clinic up north, and one of them mentioned that there's so many patients right now who are having trouble navigating the system of getting enrolled into health care or getting enrolled into a health plan. So sometimes we think of the uninsured as folks who might be undocumented. However, there might be some who are in between coverage who are just trying to navigate the system. And so we do want to highlight that we have this program available to uninsured patients. Thank you, Mary Renner and Central Valley Health Network for administering this program. Anthem was able to secure grant funding to cover e-consults for uninsured. So just a reminder to your organizations that e-consults are available to uninsured and Medi-Cal managed care patients. And we're glad to see that hopefully this makes this a little bit easier for providers. Just a couple other notes. All of this information here is in your monthly newsletter. This came out last week. If you are not getting the newsletter, you can let me know and I'll make sure to add you to the list. But our publications that come out on a monthly basis, our CME opportunities, any surveys that we have opportunities for future education and programming are in our monthly newsletters. And when we see great published information that comes out through journal articles, et cetera, we make sure to include those too. So this in the lower right-hand corner here, you can see an article on eConsult for Hep C. And that's going to be the focus of our next eConsult work group webinar. As you have probably heard, there is a program called the eConsult work group, which is actually a national gathering of those who are interested in expanding use of eConsult, supported by California Healthcare Foundation. So we meet on a monthly basis. It's happening on February 8th. And this month's call will focus on that study I just mentioned, eConsult for hepatitis C. And that's just another opportunity to share with your providers who may be focused on a specific specialty or need. This website you can see up in the upper left corner shows where you can find additional resources on eConsults and those specific to our Fresno and Tulare, Madera, Kings, and Kern counties. So our asks of you all are to think about how we might give a refresher on eConsult. Some of you may have, like every other organization across California, you might have experienced some staff turnover. Those may need some refreshers on eConsult. We're happy to talk about eConsult. The ConfirmEd team or our coalition members can speak at one of your provider meetings, or just to do a one-on-one if you have a new staff member who'd like to get up and running. Please do let us know. I mentioned the next eConsult work group meeting and the next couple of dates. Hopefully you can mark your calendars for February 8th and 16th, upcoming educational opportunities. And before we wrap up today, just want to take a moment, offer up an opportunity for any questions. You can use the chat if you have any questions you'd like to share with our team. And before we leave today, do want to thank Anthem, Calviva, and HealthNet for their support of this program. I'll open it up for a few words from the plans. I'm not sure, Mark Schreier, if you're on. Mark, do you want to share any words about our focus in 2022, where you see us going?
Yeah, definitely. We want to continue to scale and support all the good work that folks here on the call have done. One of the things, again, it's been said multiple times, I think, on this call, is that, we're in a continuing crisis. It seems like it's never going to end. And it's, our members are having challenges getting into specialty care. And I think this is the right thing to do. It's a good thing for our members, good thing for the providers and the clinic system. So if you haven't considered joining, or you are considering and you need any assistance, please reach out to us, and we're happy to help provide that assistance for you. Thank you. Thanks, Mark.
Karina Mendoza, do you have any words before we wrap it up?
Yeah, I just want to say, just echo what Mark said, and thank you to all the existing participants and new folks on the call. We've been also engaging our county departments to get involved. So hello, I see you on the call. Hi, Stacy, and also hi, Austin. Thank you for joining as new participants to the roundtable. Just really happy to see the engagement. But yes, again, if there's any questions on how to get started, please feel free to reach out for more information, and we can get you connected with ConfirmEd.
Thank you, Karina. And Jeffrey from Calviva, thank you so much for your support, Jeffrey. Do you have any words to say as we wrap it up?
Not today, Libby. Just echo what Karina and Mark just stated earlier.
Thanks so much, Jeffrey. And we're just so glad to see this unique collaboration of Medi-Cal managed care plans across these counties working together to really try to make this as easy as possible for your providers. Thank you for your input, everyone. We welcome any feedback, suggestions, needs for future material or content. Feel free to email me. You can see my email here. We are open to your feedback, and thanks for your time today. Have a good day.